DVR stands for Direct Visualized Rhizotomy. It's an ultra-minimally invasive procedure for the treatment of people with back pain due to arthritis of the spine. In the past, patients with back pain due to arthritis of the spine often underwent procedures even like spinal fusion, where the spine was opened and the recovery was very long and structures were damaged in doing it and there were blood transfusions, just very high risk of infection. Those days are done. Now we can treat back pain due to arthritis of the spine in a totally different fashion by cutting off or silencing the pain signal. The nice thing about the DVR procedure for back pain caused by arthritis of the spine is you actually get a trial. We do an injection before you ever have the procedure to see if it works. The injection is numbing and it only lasts for 2 or 3 hours, but if your pain goes away completely during the injection test and then comes back completely, we can go into the DVR procedure with virtual certainty that we're going to be able to wipe out your pain. From your point of view though, the fantastic thing is you can find out before having any procedure whether or not you're even a candidate. I mean, if you think about how back pain affects people's lives, the depression, the lack of movement, all the complications that come with that, the pneumonias, the years spent not doing anything, not living your life to its fullest, not really experiencing yourself fully as a person, you could get a shot to test whether you could be 15 minutes away from having none of those problems. Why wouldn't you try that? I mean, that's really what this comes down to. The reason you might not try it is you're depressed, or you've had bad experiences in the past, or your cousin had back surgery that didn't work. I don't care about any of that stuff. I want to know right now today if you can get better, and we can examine you, look at your scan, do the test block in one hour period, and know. Don't you think you deserve the right to know if you could lead a much fuller, better life without pain? You do. At Phoenix Spine, we're totally committed to solving your back problem in the least invasive way possible. And what that means is you can come in here and have ultra-minimally invasive surgery like DVR and be home for dinner, fully recovered by the next morning. I mean, even today, even here in Phoenix, a very sophisticated medical community, the same person with the same problem might be offered really traditional treatment like a spinal fusion. You could be in the hospital for days. Just having the fusion is undoable. A procedure like DVR, where your whole anatomy is left intact, where nothing irreversible has happened to you, traditional surgery, you've got a large incision, muscle that's been changed, hardware in your body, big risk of infection. You can never walk that backwards. And so I really encourage people, if someone tells you you need a fusion in this day and age, it's really worth getting another opinion from somebody like the doctors here at Phoenix Spine to see maybe there's a different way that your problem could be solved, which gives you more options for the future, solves your problem outright with much less suffering, much less pain, much less downtime, and is just as good with much less risk.